This episode was recorded Tuesday, May 30th, 2023, and since then, on the Ontario Health Coalition's referendum against the Ontario government's privatization of healthcare results have been announced, with 98% of voters opposed to the privatization of Ontario's public hospital services.
Like all parliamentarians, we have each heard stories from Canadians who are struggling with the high cost of living.
That's why I'm running for Prime Minister, to put you back in charge of your life.
Whose children are in classes that are larger than they were pre-pandemic.
So families once again can strive for the dream of home ownership.
Left to right.
A weekly news podcast. Hello, everybody, and welcome back to the Left to Right podcast. And today we'll be joined by Elaine and Louise from the Ontario Health Coalition in Cornwall. They'll be discussing the referendum on privatization of healthcare that just took place across Ontario. So we'll start. Elliot, you can go ahead with the first question.
Okay, so number one, can you explain this referendum that just took place?
Yes, well, you might recall that during the provincial election of 2022, the governing party at the time was asked repeatedly if they were intending to privatize healthcare if they were elected, and they explicitly denied it. So, given a majority government moving into government, they quickly began to ramp up privatization of healthcare and especially hospital services. So we felt that was a huge move. It was a sea change in the Ontario policy, in fact, in Canadian policy, and we felt that it was a big enough change that people should have been consulted. So what we did with our referendum is we brought the question to the people and asked them how they felt about this, because I am sure that had they squarely faced the issue during the election campaign, the results would not have been what they were, and the government might have backed off, like if they had explicitly admitted to intending to privatize. So what we're doing now is we're bringing the opinion of the people, and I can tell you the percentage of people who voted yes to privatization is minimal compared to the people who said no to privatization. So we're bringing an overwhelming no vote, no to privatization to Queen's Park. And we're doing this, you might say it's a public opinion poll that we have run ourselves in our communities. We were open to people to vote yes to privatization or no to privatization. And sadly, so many people who came to vote expressed confusion and sometimes doubt, but simply lack of knowledge. They didn't realize that this was a government agenda. And I think that's because even in Bill 60, when the government explicitly speaks to allowing the development of private for-profit clinics, they don't call them private hospitals or private for-profit clinics. They call them alternative community health facilities. And they use terms like that really cloak the reality of what's happening. So, frankly, our intention was to give the people a voice and let the government know what the people's sentiment was. But also, we very welcome the fact that we have this opinion that we can take to Queen's Park, and we certainly hope it will be a factor in their decision-making going forward.
Okay, so the results province-wide are expected to be delivered tomorrow at Queen's Park. Obviously, you can't share all the results now, but is there any surprises or anything that we should expect?
I don't think, no, I don't think so. As I said, the percentage of those who voted yes was very minimal. Do you recall, Louise, how many there were provincially?
Around 6,000.
About 6,000 people.
Voting yes or voting in total?
Yes, voted yes. No,
Okay.
In total, we had 387,000 people who voted, and that number is not final, in that there are still workplace votes being tabulated, because some workplaces, for example, hospitals, who ran their own vote, through their a governing body of their union, through OCHU. They have submitted their ballots directly to OCHU, so it'll take a couple of days likely for that to filter down and be attributed back to the regions in which the workers worked and voted. So locally, though, we had 4,000 and 5,000. Sorry, 4,500 people come to the polls. We had 19 polls, so we had that many who voted in person, and we had another 2,500 people who voted online, because our total was 7,000 plus for people who voted in our catchment area.
Okay.
Sorry. Now, Louise, go ahead.
And out of that 7,000 and a bit people, we had only 100 people who voted that they favored privatization.
Okay. Okay. Yeah. Thank you.
Okay, so do you think that the referendum will encourage the government to vote against privatized healthcare?
Well, the government, I think they're pretty clearly determined to promote it, but I do hope that the expression of against it from the people will make them stop in their tracks and slow down, maybe reverse course. You see, one of the reasons they say they have to do this is to reduce the backlog that built up during COVID. But it's incontrovertible that Ontario funds its hospitals lower per capita than any other province and territory. So we think that the solution to the backlog is staring everybody right in the face. All these hospitals who are forced through lack of capacity, which is a budgetary issue, are closing, for example, on weekends, not working 24/7 because they can't afford to, they don't have the capacity. And all the government has to do, instead of creating a parallel system, is simply refund the public hospitals that it currently has who aren't working 24/7 because of fiscal constraints, which are directly attributed to budgetary policies from the provincial government. You know, it has always been a challenge for public health care. There is simply so much money that can be made in health care that the hope on the part of multinational corporations and insurance companies has always been that somehow they can monetize health.
Okay.
So this is an ongoing struggle that we'll always have, and we're hoping that we are putting paid to Doug Ford's attempts to bring it in right now.
Okay, we don't have much time here, but I'll just go to another question. So, do you worry that the vote you will be conducting is going to be overwhelmingly in support of no privatization of healthcare? Because this isn't a non-partisan thing. It is led by the same people who are trying to fight privatization of healthcare. I was actually lucky to visit one of the polling stations in Alexandria, and the signs at the polling stations are lawn signs you see on the streets fighting privatization of healthcare. So are you worried that the results won't be accurate or won't be taken seriously?
Well, one always worries that they won't be taken seriously, but to have a public opinion poll, and it's more than public opinion, it's actually people who voted in such huge numbers. 387,000 plus people have expressed a no vote to this. I think it would be a very foolish government that didn't take that into account.
Okay. Elliot?
Just more to the last question, is there a general consensus of like running like what are the like is the vote like balanced, or is it like more?
Well, we didn't filter people at the polls. We advertised as broadly as we could, and anybody who chose to approach the poll was invited to vote. So we didn't filter people. The invitation was out there. We had lawn signs. We did buy a limited number, mind you, because we're a citizens group and we don't have any big funders behind us. We had ads in the newspapers, and we were fortunate enough to have a couple of good articles in the press that clearly expressed what we were trying to do. But I think the important thing, it clearly expressed what the government was actually doing while it was using vague terms like, alternative community health facilities and that sort of thing. When people realized that these were simply private for-profit clinics, it alarmed people. And our referendum question was simply this: do you want our public hospital services to be privatized to private for-profit clinics and hospitals? And the question was just so clear that people voted no. That's not what people want. It hasn't been that long since the Canada Health Act established Medicare and our public hospital system. In fact, it was 1984 that the Canada Health Act passed. So many people approached the polls who remembered a time before Medicare, or through their family histories, they knew of instances where their family personally suffered great personal hardship because of health expenses. So the popular sentiment is not for a privatized for-profit system.
Okay.
Definitely not.
So, what was the I understand the purpose of running a referendum for this matter, but I'm still kind of don't understand is what is the opposition towards Bill 60? Because Bill 60, it does, if the concern is that the people have to pay to use these private health care facilities, in the legislation, it does include that people could use OHIP cards and to cover insured services, and that
Sure.
and if
This is what's insidious about it, Nolan. The government is going to pay the private consortium of doctors who perform the surgeries, or they will pay the hospitals who perform the surgeries. But they will pay the private consortium more money than they will pay the hospitals. Okay. They are keeping the hospitals, the public hospitals, on a starvation diet. And I can tell you what's happened in Riverside and Ottawa, for example, where they regularly on weekends close their operating rooms. A private consortium comes in, and the government is even not willing, because it's a private deal. They're not willing, and they don't feel they have to tell us exactly how much they're paying for the work that the consortium of doctors is doing, as opposed to what the hospital would get.
Okay, and also you mentioned the funding to the hospitals and stuff like that in your statement there, but if the worry right now in healthcare is the wait time. So if not allowing more like options for people to get certain healthcare necessities, what should the government be doing to reduce the wait times and the backlogs that are in place right now?
It's very simple. Open the operating rooms an extra 2 hours a day, open them on Saturday, and within probably 3 or 4 months, the backlog would be cleared. All it requires is funding from the government to the hospitals.
If the results of the referendum show don't support the Ford's privatization, what is the next step?
Well, I think the next step will be on the part of the government to take. And we'll see what it is that they'll do. They'll have to do some damage control, which I hope would be a reversal of their intention to privatize to the extent that they are. And then if they don't, well, we're prepared to keep the pressure up, because I think the government, before this referendum at least, and maybe even still, they're hoping that since this wasn't a ballot issue in 2022, by the time the voters go back to the provincial ballot in 2026, they're hoping that if this program can be entrenched for 3 or 4 years, people somehow will just think there's no hope. It's already here. We're faced with it. And it won't be the big issue that we're trying to make it now. So we're going to keep it an issue until that next election for sure. And hopefully they'll recognize that and act accordingly.
Elaine and Louise from the Cornwall branch of the Ontario Health Coalition, thanks so much for making the time.
Well, thank you, Nolan, for having us, and I wish you luck in your broadcast career as well. Thank you.
Thank you very much.